Hey everybody, it's Kevin and Jenna. Excited Jenna is back and she's got some really awesome news with some stuff that she's developing and it'll be rocking into kind of this episode along those same lines and hopefully bring you lots of fun value along the way. So I'll hit the reel and we'll get going. All right, guys.
I love that.
Nice, right? We're picking it up a notch. We got our ticket bottom. We got our little logo. Haley's really getting me lined out, Jenna.
Oh my God. She's doing some amazing things. I love this. So yeah, thank you. So I feel like I mean like entrepreneurial life in general. I'm trying not to get distracted by squirrels, but I do find that like I've always, as part of like my three big pillars of like what do I want to do with perfecting peds, it's really like I want to, obviously first and foremost take care of the children, and I feel like who needs it are these medically complex kids, but then also really provide value, resources, knowledge to pharmacists when it comes to pediatrics in general, and then parents, because that we always joke that kids don't come with a manual. And I feel like a lot of the times it'd be great if they did. So I'm doing like a parenting online course with a bunch of collaborative providers. And it's going to be just very short videos, and really just basically what we would want a parent to know from the medical field. And it's not just going to be me. It's going to be OBs, lactation, pediatric dentistry, pediatricians, sleep consultants, because I completely ignored whatever they've told me to do. But people like, I'm the expert when it comes to pediatric medicine, but I just wanted to have a wealth of resources where parents can go, because I feel like sometimes we go to these like crazy Facebook like groups or pages where it's like a bunch of people, moms giving other moms really bad advice, and so, or just unreliable. And I say that in the most loving way, but really a place where we can streamline, if the expert in that topic or field, and then how you can reach out and utilize them more, and then really quick videos on if there's what's the most common questions we get, here's the answers, and if it's anything more involved, like here's how to work with us. So
wow, what an incredible resource, Jenna. I mean, just being a parent, like just the blessings of being able to have that full team you're bringing together to have quick and easy resources for parents. I'm really excited for the development of that.
Thank you. And so I thought with our PHLI, since ours is educating pharmacists who may also be parents, but educating pharmacists in this land, I kind of like how I think of it as like preconception. So what I would want a mom to know, and a dad, when they're trying, and then all the way through, when they're teenagers, and various behavioral issues, or just transitioning to adulthood. That's a big topic of like, when do they stop going to the pediatrician? So all these things will be tackled, like I said, in bite-sized videos from different experts who are just going to say, this is what I would want a parent to know.
Love it.
So the first one was preconception. So I'm excited that we get to talk about this. And really very shortly, it's parents usually come to me when they're like all excited, they're trying, but they want to know what's safe, what's not safe, and some of like your tips and tricks to actually having the best chance of conceiving.
Right.
So as a female, like some things that aren't involved in pharmacy land, but real quick, just to start off, would be track your ovulation. They have all these amazing apps now that will help you track your ovulation. And we know that that you actually can do that via your temperature. So if there's a slight temperature change, it will actually it usually correlates to when you're ovulating. And a lot of times I tell moms like to use those good old ovulation sticks. You don't have to buy any of the expensive ones, but that's like an easy way to just try to get used to, and see if I actually identified that my ovulations were very off by using that. So use those tools and those apps. But as far as really what I want to dive into is what's safe, as far as medications while trying to conceive, specifically in males and females. So in males, a lot of times we don't think like the male could possibly be taking something that's not safe, or it could be decreasing their sperm count. So specifically like testosterone, if anyone's ever taking any sort of testosterone supplements, that can actually lower your sperm count and lead to infertility. So something to think of if you're trying over and over again every month and you're not conceiving. Another thing too, that really impacted us personally, and I'm sure my husband would love me sharing this, but he was on finasteride for male pattern baldness, and a lot of guys are, and that is not safe. That can actually lead to you having teratogenic effects. So it was one of those, like, I knew as a pharmacist I had to tell my husband to stop taking his finasteride, but I don't know if every person would have told their husband that. So that's something that like is more common than we think. I'm not sure guys ever talk about that. But
it's getting more open, Jenna, like just talking about baldness and hair problems and everything. But you point out something fantastic there, that usually when we're thinking about pregnancy, way too often we're thinking just mom. And so
no,
the medical background of dad gets lost in the shuffle. Like I did not get asked in all of our pre-check visits or during any part of Savannah's pregnancy or preconception, Kevin, are you on any medications? You know, that
yeah.
was related.
And that's why I was like, what would so the reason I am creating this course is because there are so many times that I've paused in my 7-year journey of being like, wait, what if I wasn't a healthcare professional? Like nobody has ever asked Steve any of these questions. And so I knew he was taking it. And I was like, oh yeah, you have to stop using that. Like I totally, so again, I don't know, like testosterone and, finasteride are more common than we think. And that's something that, just to have that discussion as you're trying, those are things, medications that aren't safe for the guy. And then medications that could be decreasing his sperm count and making it so it's difficult for you to conceive as the female. For the females, like I always give the blanket statements that the safest SSRIs are Lexapro and Zoloft, but they're not the only ones that you can be on while pregnant. And it's every patient's so different. It's risk versus benefit. I always do tell moms that have major mom guilt for continuing any of the medications for mental health. I say we know the literature shows that it is way more detrimental to have a mom with untreated anxiety and depression than it is to have a mom on an SSRI, specifically Lexapro or Zoloft. There are other ones and also some SNRIs, but really if you can get on ideally one of those two, it's great. I'll use myself as an example. I am married to a Fexer. I could not come off it. I've been on it since I've been 16, and it's just the one med that works. So knowing that, the stress I would put on a fetus when I have my panic attacks would be astronomical and predispose me to having a preterm baby, and early delivery was way more detrimental than me continuing my Fexer. So those are just the conversations to have with your healthcare professional, that, and just to think, because there's so much mom guilt involved, that you don't have to come off everything and, go into massive depression or anxiety. You have to have those conversations of risk versus benefit with your provider. And that's a common question I get from a lot of moms, like, is this safe to continue? A lot of times it's their primary care doctor who's saying they don't feel comfortable them continuing it. So that's when you really want to loop in pediatric pharmacist who's trained in it, or the high risk fetal maternal medicine services, because you don't have to be all organic to conceive. And so, and sometimes that's not great, but in that same breath, obviously the best way or most chances you're going to conceive are obviously if you're in good health, whether that's weight, taking care of yourself, working out, and it doesn't have to be intense, just moving your body, watching what you eat. And then in that same vein, having a over or underactive thyroid is one of the most common reasons mothers cannot conceive. So if you find yourself month after month not being able to, that is something 100% that you would want to have checked.
Jenna, I had one question because it's funny, when we started this episode, the one thing I was thinking that you were going to start with, which I might grab a clip from, is what about when we're thinking about conceiving, the first thing that I think comes to my mind is, seems like everybody is on a birth control.
Birth control. Oh, yeah.
Yeah. And I was really hoping you could tell us a little bit about that's like the first step that I'm thinking is all the problems that could be from an implant, from a 3-month cycle to a 1 month. How do you get off it? All of those pieces. Could you educate us?
That's another thing I did want to talk about. So they say birth control usually to stop like ideally 3 months before you want to actually conceive. That being said, you do have the rare chances where they stop and the next month they conceive, but it does take your body. I know it does take your body a little bit to get, regulate it, because, your body, like I was on one that I only had my period every 3 months. So my body was like so confused getting back into that ovulation cycle. So ideally 3 months before, yes, Kevin, thank you for bringing that up. You want to kind of purify your body and get off of it. But, there's chances that it could take a lot less time than 3 months or more. And so, but that's like the general rule of thumb. The other thing to think about is your topicals. So a lot of times, like a mom or even sweet age, we love to put retinol and bathe ourselves in it. You can. I would take a bath in it if I could. You cannot use that. So a lot of the anti-aging products, just look out for like retinoid derivatives, because they're not safe. Try to stick to, like, if you can. I know some women have acne. Salicylic acid is not safe in pregnancy, but you can do benzoyl peroxide, and a lot of those like CeraVe, with a lot of the ceramides in it are great, and more of the more mild and gentle ones. That being said, I always struggle with acne, so benzoyl peroxide's fine. But those are really like the most common questions I get are topicals, what are safe, what are not safe. I'm on, if you're saying birth control, they usually come to me after they've been off the birth control, but yes, 3 months is ideal. Making sure you check with what you're actually taking. It might be safe and you're like preemptively stopping it. And then start a pregnancy multivitamin, because the most important thing in that first few months is, or first couple weeks even, is getting that baby folic acid. And it's just to ensure they decrease their chances of spina bifida. Make sure you're screening what your husband is taking as well. That's my little pearls.
Those are fantastic. Yeah, I think the the choline and folic acid, massively important, and I think more and more evidence coming out about the overall impact for your child. The other ones I think with birth control that I was going to ask you before we close out is, a lot of people do take orals, right? And that 3-month window is definitely there. Any advice, Jen, or any thoughts for them? Like if they have an implant, or if they have intravaginal, what are some of the differences there?
I think, you think of like their half-life and everything. I don't think that there's abundance to say like how long you take it out to when you conceive, or when you can conceive, or when you should expect to. Rule of thumb is usually like 3 months before, regardless of what it is.
Great. That's super cool. I love it. Okay. So for me, and the takeaways for all my family that are going to try to conceive, go and talk to Jenna first would be fantastic. Set up an appointment with Perfected Peds. But along those exact same lines, when it comes to just starting off the journey, getting off of your original agent that's preventing you from doing so, 3 months, great way to do it. Tracking those ovulations to be able to get those things in rhythm, and then checking the rest of the medication regimen, which should include topicals and what your husband is taking. Make sure you're gearing up is this kind of the summary. Awesome.
Yes, and start your prenatal, just so. Yeah, and I think as time evolves, the methylated folic, like that gene, I think is going to come into play, and I think we'll know a little bit more. Like I know my own daughter's deficient in it, so they actually need a different formulation of folic acid. So I think as pharmacogenomics, PGX becomes the standard of care, I think we'll know even more how to prevent spina bifida as that progresses. I know right now it's like controversy because we don't have enough literature, but I think it's enough to say that it's definitely an area of interest. And as I think it's just going to be standard of care for everyone to get PGX. So just something else to think about in the back of your mind.
I love it. No, I think that's fantastic. And you've left so much meat on the bone for us to do for the next episode. So I'm excited about it. Well, everybody, if you want to hear more from Jenna on the pharmacy side or on the patient side, you can find her over at RPH Ally. She's developing some awesome courses on kind of helping everybody kind of in the entire journey of having children through taking care of kids all the way up until the teenage years. So be prepared when Jen and I talk about teenage years with our young children in tow. I'm nervous about that, Jenna.
Yeah, it's just medical advice because I don't have it all together outside of that.
I love it. Everybody have a wonderful day, and we'll be talking to you soon.
Take care.